And Dr. Rajneesh, would you like to take this further? Exactly what happens? So perhaps if you could
So,
explain in English first what happens in an obese male.
right, sir. Right. So, basically, what happens is that actually the concentration of testosterone reduces because of increased fat. There is increase in sex hormone binding globulin. So when there is a change in the sex hormone binding globulin, this globulin basically binds to the sex hormones like testosterone, as in men's case we are talking. So once there is a change, there is an increase in sex hormone binding globulins, definitely more amount of testosterone gets bound to that SHBG globulin. So less of the free testosterone or the active form of testosterone, we can say, becomes available for intratesticular effects of spermatogenesis. And when lesser amount of free testosterone is available, definitely the concentration reduces in the blood as well as in the testes, and which reduces the spermatogenesis. So patient lands up with the oligospermia, or less sperm count, as we can say in a simpler language. Another thing is that, as you rightly said, that there are because of increased fat, the aromatase, that is the name of enzyme is aromatase, its activity increases in increased fat, so that testosterone gets more converted to estradiol. As sir said, that all of us, whether we are men or women, both of us are having both hormones, that is male hormone testosterone, female hormone estrogen or estradiol, we can say. Like there are three forms: isoforms, active form, inactive form. Let's not go dig into that detail. And then there is a disbalance, actually there is a disbalance of the ratio. Males में testosterone ज़्यादा होना चाहिए, estrogen कम होना चाहिए, and it's the other way around in females. But in males, when they are obese and then when there is a more peripheral aromatization, it becomes available and it gets more converted into estradiol. तो पहले तो SHBG बढ़ गया, टेस्टोस्टेरॉन, टोटल टेस्टोस्टेरॉन तो बढ़ गया, लेकिन फ्री टेस्टोस्टेरॉन जो कि हमारा एक्टिव था वो हमारा कम हो गया, which reduces the spermatogenesis. And in turn, in periphery, we जो बचा खुचा था, some amount of that also is getting to converted to estradiol. So ultimately, these effects actually lead on to subfertility. They reduce to the testosterone to such a critical level that we are unable to, increase sperm count. And important thing that has to be kept in mind is that when we specially investigate these gentlemen, their testosterone levels will come normal, because more or less we are doing total testosterone in these gentlemen. Of course, we can calculate free testosterone levels, and again discussion goes to our another angle. But in routine, all labs, all of us, the first prime investigation is testosterone. So mere having a normal testosterone in an obese patient again does not tell us that whether this guy is having any obesity related subfertility because of reduced free testosterone availability.